Hello, everyone, and welcome. We're just going to wait a few more moments because I see people are still joining, but happy to see you all. It's good to see that there's a lot of interest in this topic. And we're quite a lot of participants today. So if you would like to get to know some of the other participants, you can use the chat. You can write down your organization, what you do, maybe also why you're just interested in PVC and attending this webinar. That would be good for us to know as well. So just maybe a few more moments and then we can start the webinar of today. So I'm just going to have a look at the chat as well. So you can use it if you want to communicate to us if there's anything. And then I think we are ready to start. So a very warm welcome, everyone. It's great to see that there's so much interest in this very important topic that Healthcare Without Harm Europe is working on for already quite some time now. And I'm not the only person here today. We have a few speakers that I will present to you in a moment. But before we start, I want to give you some more practical information. So this webinar will be recorded. We just started the recording and then we will share the slides with you after the webinar. So as I said before, you can use the chat function if you want to give some more explanation about yourself, your organization, what you're doing, and so on. And there's also AI translations available. So the agenda for today is quite full because it's such an important topic that we want to cover most of the ground. And we'll start with PVC and its impact on health and the environment, the negative impact that we see. Then we focus a little bit more specifically on PVC in healthcare. And then we will also explain you some more or give you some more information about the PVC-free project, an important project that's going on in Germany right now, where we're working together with a project partner and with hospitals. Then we also have someone from Médecins Sans Frontières here today to talk about their work on PVC. We'll discuss how to eliminate PVC. You will get some recommendations from us, some closing remarks. And then there's also some interesting engagement opportunities that we would like to share with you. Then the speakers of today. So I have two people here from Health and Environment Justice Support, Olga and Alexandra. So thank you very much again for joining and for presenting in this webinar. Then we also have Elia from Médecins Sans Frontières. And then there's my colleague, Mark, who will explain you a little bit more about our PVC-free project. So to start, I'll give the floor to Olga.
Yeah, thank you. Thank you very much, Tatiana, for the introduction. And I would like to start the discussion with a question. So why has PVC become such a significant concern in healthcare and beyond? So PVC is plastic, and its impacts occur throughout its entire life cycle. And the problems begin at the production stage, where manufacturing PVC relies on hazardous chemicals and energy-intensive processes that use fossil fuel feedstock. And PVC reduction actually supports healthcare climate goals and net zero commitments. And many hospitals now have climate strategies. So this connection is increasingly important. And also, toxic emissions occur throughout PVC production and disposal. And communities living near PVC and vinyl chloride production facilities are often exposed to pollutants linked to serious health risks, including cancer. And vinyl chloride is the building block used to manufacture PVC. And it is classified as a known human carcinogen. And occupational and community exposures occur around production facilities. So the concerns continue during product use because PVC medical devices frequently contain additives such as plasticizers and stabilizers and other chemicals that are not chemically bound to the plastic and can migrate into patients or the environment over time. For example, many PVC products contain hazardous chemicals, including plasticizers such as phthalates, and that have been associated with endocrine disruption and reproductive toxicity and other health concerns. Just to give you an example, DEHP or D2-ethyl phthalate is a phthalate plasticizer commonly used to make PVC flexible. And DEHP can migrate from medical devices into patients and has been linked to reproductive and developmental toxicity, as well as endocrine disrupting effects. And DEHP is classified in the European Union as reproductive toxicant and endocrine disruptor for human health and substance of very high concern under REACH. So in addition to phthalates, heavy metals have historically been added to prevent PVC degradation, such as lead compounds, cadmium compounds, and some older medical and building products still contain these substances, and they can reappear in recycled PVC. Also, flame retardants are used in some PVC cable and flooring and equipment applications, such as brominated, chlorinated flame retardants. Some are persistent and bioaccumulative and toxic. Chlorinated paraffins, both short chain and medium chain chlorinated paraffins, are sometimes used as plasticizers and flame retardants in PVC formulations. And PVC production and some PVC containing products may also involve PFAS, or per and polyfluoroalkyl substances, known as forever chemicals, as they are used as processing aids or surfactants or coatings or surface treatments. And also dioxins and furans, which are known as persistent organic pollutants, are not intentionally added, but are formed during the production and disposal of PVC, and then can be released during PVC manufacture and accidental fires and open burning and incineration. So these are the most toxic chemicals known and are linked to cancer and immune effects and reproductive harm and endocrine disruption. So these examples illustrate how PVC can be associated with a broader range of hazardous chemicals beyond phthalates alone. And finally, at the end of life, PVC creates additional challenge because recycling remains difficult and limited, while disposal through incineration or uncontrolled burning can release highly toxic substances. And as a result, PVC contributes to pollution and climate impacts and waste management challenges. But unfortunately, health providers often do not know the full chemical composition of the products they purchase and use. And greater transparency on additives and plasticizers, stabilizers, flame retardants, and other chemicals is absolutely essential for informed procurement decisions and safer alternatives. And for healthcare systems committed to protecting health, these life cycle impact raise an important question. Can we continue relying on a material that creates health and environmental burdens to every stage of its existence? And next slide, please. So PVC is actually deeply embedded in healthcare systems and often invisible to those who use these products every day. So many common medical devices rely on PVC because it is flexible, it is durable, and relatively inexpensive. And this includes intravenous tubing and blood bags and catheters and feeding tubes and oxygen masks, respiratory equipment, and more. So in intensive care units and operating theaters, PVC is also used in ventilator circuits and drainage systems and extracorporeal circulation equipment. So the widespread use of PVC means that exposure can occur repeatedly, particularly among patients requiring long-term treatment. Neonates and critically ill patients and people undergoing dialysis or intensive medical procedures may experience especially high exposure levels. And toxic chemicals can leach from PVC blood bags, intravenous tubing, and catheters. So studies have found elevated phthalate metabolites in premature infants receiving intensive medical treatment. But the good news is that understanding where PVC is used is the first step towards replacing it. And today, many healthcare providers are already identifying priority products for substitution and demonstrating that change is possible without compromising patient safety. And next slide, please. So summing up, I would like to note several reasons why healthcare organizations are increasingly focusing on PVC phase-out strategies. First, many PVC products contain hazardous chemicals, already discussed at the beginning of this presentation. For example, pesticides such as phthalates, which have been associated with endocrine disruption and reproductive toxicity and other health concerns. But PVC products may contain a complex mixture of plasticizers, stabilizers, heavy metals, flame retardants, chlorinated paraffins, and other additives. So in addition, the production and disposal of PVC are associated with hazardous substances such as vinyl chloride and dioxins. And this means that replacing one problematic plasticizer, such as, for example, DEHP, does not address the broader health and environmental concern associated with PVC throughout its life cycle. So second, some patient groups are especially vulnerable, and premature infants and pregnant women and chronically ill patients can be exposed repeatedly through multiple devices during critical periods of development and treatment. Also, healthcare workers may be exposed through routine handling and use of PVC containing products. But beyond direct exposure, PVC contributes to toxic emissions through its life cycle from production to disposal. And these impacts extend way beyond hospital walls and affect workers, and including those who deal with waste, as well as neighboring communities and ecosystems. And PVC definitely pose significant challenges for a safe circular economy because of its complex chemical composition. Recycling is difficult and can contribute to the recirculation of hazardous chemicals, hazardous substances in PVC recycled products. It means that PVC-free procurement contributes to healthier workplaces. And this is not like simply a theoretical discussion. Safer alternatives already do exist for many applications, and healthcare systems across Europe have demonstrated that substitution is both feasible and effective. And next slide, please. So Fortunately, healthcare organizations do not need to wait for future innovations to begin reducing their dependence on PVC. A wide range of PVC-free alternatives are already available and being used successfully in hospitals and healthcare facilities. And depending on the application, alternatives include non-plastic alternatives such as glass, stainless steel, silicone, natural rubber, ceramics, cotton, and linen. They are already widely used in healthcare. For applications where non-plastic solutions are not yet feasible, PVC-free materials offer an important transition pathway towards safer healthcare products, such as polyethylene, polypropylene, or thermoplastic elastomers, where innovation continues toward reusable and non-plastic solutions. So several countries and healthcare providers have already adopted policies to phase out PVC from selected product categories. And these experiences demonstrate that patient safety and clinical performance and sustainability objectives can be achieved simultaneously. And healthcare providers have an especially important role to play because procurement decisions help shape markets. And by requesting PVC-free alternatives, hospitals create demand and encourage innovation and help manufacturers invest in safer solutions. But while PVC-free products have an especially, they represent an important step for it. Healthcare providers should also evaluate the safety profile of replacement materials and avoid regrettable substitution with chemicals that may pose similar health or environmental concerns. And you may understand regrettable substitution through familiar examples. Certain brominated flame retardants replaced by structurally similar chemicals that later raised comparable concerns. Or long-chain PFAS replaced by short-chain PFAS that remain highly persistent. And just to mention again, so the issue is not only phthalates, it is the PVC system itself. And the transition will not happen overnight, of course, but every purchasing decision can contribute to building a healthcare system that better protects both human health and the environment. So thank you very much. And back to you, Tatiana.
Thank you very much, Olga, for this very first interesting overview and presentation of the negative impact of PVC in general and also in healthcare. Now, the next person I would like to introduce is my colleague, Mark, to discuss the PVC-free project. The floor is yours.
Thank you, Tatiana. So I just wanted to give you an overview of a current project that is happening at Healthcare Without Harm Europe, supported by UBA, which is the part of the Federal Ministry for Environment, Climate Action, Nature Conservation, and Nuclear Safety of Germany. And so this project is specifically being rolled out in Germany, but it aligns really closely with the work that we do at Healthcare Without Harm Europe, then towards PVC-free healthcare. So just what we've seen so far in the project, there's sort of 4 pillars across. So implementing substitutions, some training, market research, and then developing cost solutions. So I'll walk you through just each step quickly, and then I'll introduce exactly where these things are taking place. And thank you, Carolina has just added the link to the project page as well on the chat. So if you're curious to find out more information, then there is the link there to the project page on our website. So again, the implementing solutions part, the project really developed through understanding what PVC containing products exist within certain care settings, and then trying to identify alternatives that could then be implemented. And so this was a really interesting process in working with hospitals to develop those lists of what PVC-containing products exist, and then trying to find alternatives in the market for those. As Olga said, there are alternatives that exist in the market. Some of them are well adapted and can be switched right out. Sometimes it's harder to find them. But that's, trying to identify those already is a big step. There was also a training aspect, similar to what we're doing here, is really about information and understanding for healthcare providers, especially. So having a better understanding of what PVC is and what the risks are, and then increased readiness to implement within the hospital. So ensuring that, when substitutions are going to be made, that the training is there and available for healthcare staff to be able to push those things forward. Another big piece of this project was the market research. So really trying to understand deeply, specifically in Germany, but also across Europe, what substitutions exist, what the barriers are, and how to develop solutions towards being able to overcome those. And so a lot of the findings through this market research were that substitutions are limited and very specific to certain applications, especially more in the more harder plastics. When you're looking at things like IV tubing and things that are flexible tubing, then PVC is still quite prevalent, and um, there's not as many substitutions available in the market or alternatives available in the market. So that also leads to the need for innovation in the market. The part of our work is working with hospitals to be able to push for that a little bit, to start to advocate for that. And then, a quick solution that we found is optimizing use. So just simply making sure that care pathways are well designed and that the use of PVC containing products is only used when absolutely necessary. So you're not including PVC products in items that or in care pathways that aren't necessarily needed. So for instance, if you can give an oral medication instead of an IV medication, then you're significantly reducing the potential of being exposed to PVC. So those are some of the substitutions and some of the quick solutions that can really, make quick changes, but don't necessarily affect care. And then obviously there's cost solutions. So, going through the market research and even the implementation, we found that there are some cost limitations related to switching from PVC to safer alternatives. And this led to, an understanding that some products, if you're trying to make a direct switch to a non-PVC product, they can be more expensive. And so making sure that we pool demand. So, if we have a product that's used across many hospitals or an entire health system, that if you're able to demand from the supplier that you switch that to a non-PVC product, then you may be able to drive the cost down. And that's a really important piece of being able to affect the market and to be able to move things forward in terms of really trying to make change in this PVC area. So if you go to the next slide, I'll just have a quick example of what's happening in the projects. Hang on. Sorry, my daughter just interrupted. Classic working from home. So the hospitals which are part of the initiative, so we have two hospitals, like I said, in Germany, BG Klinikum Bergmannstraße Halle in Bergman, Germany, who are working to substitute respiratory tubing. Again, a flexible tubing application. And so they've been working for a while. We've identified the product that we are going to substitute. Haven't fully implemented just yet, but on its way. And then as well in Darmstadt, the Darmstadter Kinderkliniken is substituting these child heat and moisture exchange filters. So again, the heat and moisture exchange filter is a more rigid piece, so a little bit easier to find PVC-free alternatives. And that is being implemented right now. And the sizing is better for neonates, so they're starting to use it in their neonatal ward. And they've made that switch. And again, it's a slightly more expensive product, but we're hoping to be able to show the decreased risk of pollution and the ability to potentially to the pool, the demand, to be able to bring those costs down in the future. So just wanted to give a quick overview. I hope that was clear enough. But of course, feel free to ask questions in the chat about the project, or to follow up with us at Healthcare Without Harm Europe with myself or with Tatiana. Thank you.
Thank you very much, Mark, for explaining this very important project with a lot of learnings. And now I like to introduce our next guest, Elia Daly from MSF, and she's going to explain you a little bit more about the important work of MSF and PVC and how they phase it out.
Thanks a lot, Tatiana. So hi, everyone. My name is Elia Daly. I'm the Sustainable Medical Product Advisor at Doctors Without Borders, Médecins Sans Frontières, working at the intersection of health and environmental crises around the world. MSF is increasingly addressing the environmental footprint of healthcare, including the growing challenge of plastic waste and single-use medical products. In 2019, MSF committed to halving its carbon emissions by 2030. So we conducted a carbon footprint assessment and developed a roadmap covering all 3 emission scopes to achieve this objective. Today, I will focus on medical procurement, particularly single-use medical items. This represents the majority of the environmental impact associated with medical devices in our operations, and some of them contain PVC. And next slide, please. We are currently working on a project called Rethinking Single-Use Medical Items with a clear objective to reduce the environmental impact of single-use medical items. We approach this from 2 complementary angles. First is medical practices. So the rational use of medical items is closely linked to quality of care here. The second angle is procurement decisions. Product selection has significant environmental implication and can often improve sustainability without compromising quality and sometimes even enhance quality. So there is room for improvements by avoiding hazardous chemicals, replacing high-impact plastics with lower-impact alternatives, it's been mentioned before, and implementing reusable options where feasible. In addition, we focus on engagement, so we do not want to act alone. We collaborate with other organizations and stakeholders to influence the markets and accelerate change at scale. Next slide, please. The first step for us was to identify our priorities. So our catalog contains around 4,000 references of single-use medical items. Clearly, it is impossible to address all of them at once. So we needed to create a ranking, and for that we identified the most procured items and assessed their environmental impact using a simplified life cycle assessment based on 3 indicators that are climate change, human health, and plastic pollution. The 3 were then weighted by procurement volumes to estimate the total impact of each item. We also incorporated here factors specific to MSF operations, such as long-distance transport and limited waste management infrastructures. In many of our projects, waste is incinerated under suboptimal conditions, generating toxic emissions that can affect surrounding communities. Next slide, please. This process resulted in a short list of the 20 highest impact single-use medical items that you can see here. Interestingly, the results are quite similar to those observed in other healthcare facilities that have conducted comparable assessments. These 20 products account for approximately 40% of emissions associated with single-use items and around 4% of MSF total emissions. Most of these products are plastic-based. They are procured in very high volumes, and they are all essential medical products, including syringes, infusion sets, and personal protective equipment. This is important because it shows where the greatest leverage lies. By focusing on a relatively small number of products, we can achieve meaningful reduction without compromising quality of care. The blue stars indicate products containing PVC. This includes the well-known example of blood bags, but also IV sets and other flexible tubings products where PVC remain widely used. Next slide, please. When we take a closer look at the materials used in these products, one material clearly stands out, it's PVC. These results come from the simplified LCA and highlight the contribution of different materials to the overall impact. PVC shows a disproportionately high impact because it contains chloride, it's been explained before, and it releases hazardous substances throughout its entire life cycle. Its impact is particularly significant in MSF context where waste is frequently incinerated, again under suboptimal conditions. So one of the key conclusions of our assessment was that PVC is particularly problematic for both human health and the environment. We also found that the presence of PVC is strongly associated with higher impact products. And in addition, we observed a 97% correlation between product impact and product weight, highlighting opportunities to reduce impacts through material reduction and packaging optimization. Next slide. The mitigation measures we are implementing follow the waste hierarchy with a strong focus on upstream intervention that prevent waste generation and reduce toxic exposures. First, to reduce unnecessary consumption through more rational use and better adherence to existing guidelines for medical practices. This also brings strong quality of care benefits. Second is to introduce reusable products where feasible, particularly for medical textiles such as surgical gowns and caps. Then to refuse by integrating environmental criteria into product selection processes and request greater transparency from suppliers regarding plastics and additives. And finally, we work with suppliers to innovate, optimize packaging, reduce material use, and replace problematic materials. Our purchasing power alone is limited, and this is why collaboration is essential. We need to build coalition and to work collectively to drive market transformation. Next slide, please. To summarize our procurement objective, we tend to reduce material use and product weight wherever possible, also to phase out PVC where feasible, and at minimum to phase out DEHP and other problematic phthalates. Next slide, please. Let's look more closely at some of the products in our top 20 list that contain PVC. Unfortunately, only PVC blood bags are currently available on the market. We know that around 10 years ago, the Karolinska University Hospital participated in a project with industry partners to develop and pilot a PVC-free blood bags, but the product did not reach the market yet. One of the main reasons PVC blood bags remain the industry standard is the use of DEHP plasticizer, which helps stabilize red blood cells during storage. But as Olga previously explained very well, DEHP also leaches into patients during use and is associated with harmful health effects. When exploring DEHP-free alternatives, it is important to understand what DEHP has been replaced with in order to avoid regrettable substitutions involving other hazardous chemicals. This concerns also other products made of PVC. So we hope for future innovation, that future innovation will enable truly PVC-free blood bags, or at least DEHP-free blood bags. Next slide, please. Thank you. IV sets are another important example. So they are procured in a very large volume and rank second on our list of highest impact products due to both their environmental impact and procurement volumes. We are currently exploring PVC-free and DEHP-free alternatives. Our current supply is partially DEHP-free. This is encouraging. However, some components such as the drip chambers may still contain DEHP. Here, price remains a major barrier for us. The PVC-free IV sets do exist on the market, but they are significantly more expensive. The PVC PVC-free options proposed by our current supplier are 4 times more expensive than the PVC alternative, although our market assessment is still ongoing. Even though improving transparency regarding product composition is already an important step forward for us. As with any sustainability challenge, the first step is understanding the issue and making it visible. So to conclude, next slide, please. I would like to briefly mention the key deliverables we are currently developing. Our main objective is to build internal capacity by helping our medical and procurement teams to better understand these issues and equipping them with practical tools to achieve concrete results. So on the medical practices side, we are developing a handbook of documented sustainable practices. On the procurement side, we are organizing training sessions on product sustainability and environmental criteria. We are also developing an engagement package that consolidates our long-term sustainability requirements with the aim of driving innovation among suppliers and joining forces with like-minded organizations around shared objectives. Thank you very much for your attention, and thanks for the invitation and the opportunity to share our work. We know this is a long journey and collaboration will be essential. In that spirit, I would particularly welcome connections with organizations that have already developed PVC phase-out strategies, such as healthcare providers in the Stockholm region or the Austrian hospital network. We try to reach out to you. One challenge we face is the limited availability of user experience data. So if anyone in the audience has successfully implemented or procured PVC-free products, I would be very interested in learning more, and particularly how you managed issues related to pricing, implementation, and change management. So please feel free to reach out after the webinar. We would be delighted to continue the discussion and learn from your experience. Thank you.
Thank you very much, Ilia, for this very interesting presentation and the important work that you also are doing in your organization. If there's any questions about this presentation, you can ask your question in the chat, and we will try to answer them. And now for the next part, I would like to give the floor to Alexandra, who will explain you more about recommendations for healthcare providers, policymakers, how to eliminate PVC. So Alexandra, the floor is yours.
Thank you, Tatiana. Thank you for having us today. Yeah, so you are a healthcare provider. So what can you do to eliminate PVC? Of course, you can influence the market supply, meaning that you can prioritize purchasing from suppliers that offer PVC-free products and advocate for the use of non-toxic materials in medical devices and packaging. First of all, before you purchase things, it would be good to have like a survey of what you are already using and making like a inventory of what you're using. So the influence of the market supply is very important because, as previous speaker said, some alternatives are maybe more expensive, but if you work together, you influence the market and also can achieve better prices. It is important for you as healthcare providers to demand from the manufacturers that they should publicly disclose information on alternatives. And as we also heard before, it's important to raise awareness, educate staff on the environmental impact of PVC products, and encourage their sustainability efforts. As you have seen, there is already like awareness raising materials on the market, also provided by Healthcare Without Harm and others. So please do reach out to them and ask for support. Next slide, please. So you are a policymaker, and I see in the list there are not so many joining us today, but what do we want from policymakers? We want that they do not exempt the healthcare sector from a PVC restriction, which is in the making for a long time, but not there yet. So the medical products and devices should be, of course, included in such a restriction. Because it is important to protect patients from the exposure to harmful chemicals. Therefore, as you already heard, we want to have PVC substituted with safer alternatives. It's also important to encourage and boost opportunities for PVC-free products. Alternatives are there, but sometimes expensive, so they need some support also from policymakers to put their alternatives on the market. More innovation is needed. There's an innovation gap. Also support for incentives for innovation is needed, and there should be more research programs. And it should not stop with the research. They should also come to the market. And then another recommendation we have more for the global level. It is important to include medical uses and medical devices in provisions of the future UN Plastic Treaty. We all know this is still under discussion, but there is a huge threat that medical uses could be exempted from this treaty, and that would be very harmful for patients, but also for people who work in the health sector and deal with these products every day. Next slide, please. So we think policymakers must restrict PVC and its harmful additives. We want to have PVC-free alternatives, and they should be promoted. We also would not want to see that phthalates are being substituted by alternatives that are also harmful. This would not address like all the health risks that come with PVC products. As Olga already said before, PVC should not be part of any circular economy. We want a non-toxic circular economy, which means we need a strict regulation that goes beyond phthalates and should address PVC as such and all the associated risks. We would like to show, and this is what we're doing also with this webinar, that there is a PVC-free healthcare possible, and there are already successful examples in the sector. So that should be supported by policymakers. And let's go to my last slide, please. Of course, there are more actors than people working in the healthcare sector and manufacturers and policymakers. We also, of course, have recommendations for manufacturers. So please substitute harmful substances, and not with regrettable substitution, like finding real solutions that do not pose any risk to people and the environment. So it would be good to have a conversation with manufacturers about how to have safe chemicals and how to have PVC-free alternatives. Increasing transparency is key. So only if customers and also the public know what is in a product and how harmful the ingredients are, there is a mind shift. If we are being left in the dark, there can be no change. We need to understand what chemicals are in products and materials. And this is not just, shouldn't apply just to PVC, but also to other products. Let's focus on PVC-free. Let's focus on innovation, research, and and replacing PVC instead of continuing this harmful practice. Also with influencing policymakers, for instance. So there is a lot to do. We're here, we're ready, and I'm more than happy to work with you all on making these recommendations becoming implemented reality. Thank you.
Thank you
So I give the floor back to Tatiana.
Thank you very much, Alexandra, for this interesting overview and also for these really important recommendations. So we have heard a lot already today about the impacts of the harmful impact of PVC, the environment on human health. And we asked the question in this webinar, are we there yet? And I don't want to answer by saying yes, no. I think the answer is quite clear to everyone that we're not there yet. So as we highlighted now is that we still need innovation in certain cases. We need better pricing and more transparent data regarding materials, also regarding substitutions in healthcare products. And the message I really liked throughout the different presentations is that we need to collaborate. We really need to join the forces that we have. We need to use our voices to really work on moving this, the supply and then the market forward to hopefully decrease the prices and also to give a sign to policymakers to really work on or push for innovation in the market as well. Because in the projects, we are already proving that it is achievable. We're working together with hospitals. I saw some other people in the chat also mentioning their work. So it's not an illusion, it's something that we can really work on all together in the future. And we see also in this webinar, just by having you here, that there's a strong interest in this topic. And we've been working on this topic for already a long time in Healthcare Without Harm Europe. So I just wanted to say, let's collaborate on this topic and let's also share the information that we have. That's what we're trying to do here, but also feel free to share everything that you're doing from your side in the chat. And then I'd like to continue with some opportunities for you as well to engage. So we drafted a letter to the European Commission where we are basically calling for a phase out of PVC for all the reasons that you heard today. And if you want to sign the petition, you can scan the QR code. My colleague will also put the link in the chat because it is a very important message that we're trying to get across. And of course, we can give you all the information and then try to influence the decisions that are being made by policymakers. But I think a lot of you here, healthcare professionals, are making the real difference. It's your voice that really matters. It's you that can really push this forward. So this is an open invitation to all of you to have a look and to maybe sign a letter if you really want to participate in this as well. And I also heard from Elia that she also wants to know more about the work that you're doing on PVC. So reach out to her, reach out to us as well, and we'll share the findings and also your best practices with each other, because it is, I cannot emphasize enough how important it is to share. That's also why we are organizing webinars, working groups, and so on, because we need to learn from each other. That's why we're here. So this is, again, an invitation to just contact us if you have some more information, or also if you have a question. We're there to have an open conversation with you. And then another very interesting part of the work that we're doing is in the project Born Green Generation. Maybe some of you have already heard of it. It's a very important project next to the other projects that we also highlighted today, where we really focus on the first 1,000 days. And also what you heard today is that a lot of these medical products that contain PVC are in contact with, for example, babies. They're being used in neonatal wards and so on. So it is so super important to really use the information that we have and spread it across other hospitals and also in this project, which we are doing. And currently in this project, we really want to work on decreasing the plastics that are being used in hospitals, and also by doing so, reducing the toxic chemicals. And right now we're running what we call a fast follower program to invite you as a healthcare practitioner or as a hospital to come to our workshops, to learn from each other, to get some training on how you can substitute certain things in your wards, to really work on sustainability and to work on more on a safer environment with less plastics and less toxic chemicals. So it's a really interesting journey that we're doing here. If you're interested, please sign up, reach out to us, and we'll be happy to connect. And then I think this is the very last piece of information that I wanted to share with you, because you're all here now. I really wanted to invite you to our Circular Healthcare Summit, which is an in-person event in September, where we will also highlight again the impact of PVC in our sessions, because it cuts across all the work that we're doing, of course. It will be a full day event in Brussels, and we'll send out more details after the webinar. So you can register and sign up. But before we close this webinar, I really want to thank you, because there's such a big group here, and it's so nice to see that there's so much interest. And I think I can speak for all the people who presented in this webinar today, that it's such an important topic. We see there's clear interest to change, to work on this. And I'd like to highlight what the other presenters also mentioned, and what I also mentioned again is the fact that we need to collaborate. We need to work together to really change the healthcare sector. So this is an open invitation to take action together. Please reach out to us if you have any questions. I think we can all learn from each other, and we're here to support each other in this whole process as well. So yeah, the last message I want to give to you is that hopefully together we can really create this positive impact, because there's still some challenges, but I'm also very hopeful to see you all here and to connect and to work together to have a hopefully lasting positive impact in the healthcare sector, where there's also so many good things happening, and we just need to make it more healthier with the products that we're using. So yeah, let's work towards that more sustainable healthcare sector altogether. And I would like to thank you very much, and I'm thanking you for all the presenters to come to our webinar, to share what you're doing in the chats, because I see there's people from all over the world, so that's just wonderful to see. And I hope to see you again at a later stage. So thank you very much, and thanks everyone who presented something today.